Reports from inside Syria continue to point to a much broader spread of COVID-19 than the number of confirmed cases.
The United Nations has been reporting rising infection rates in Syria for some time now.
Given the limited testing across the country and challenges in contact tracing, it is likely that the actual number of cases far exceeds official figures.
The Syrian government reports nearly 4,500 cases and 200 deaths and portrays the situation as under control. But multiple sources question that narrative. They say infections have been in the tens of thousands, and at least 65 doctors died as they struggled in ill-equipped hospitals with a lack of protective gear.
Many patients are treated at home because hospitals are not equipped or do not have the capacity to deal with these patients. Many hospitals have closed their doors to COVID patients because they did not want to infect other patients. The government have designated only 1 or 2 hospitals in every city to accommodate COVID patients.
Infections have also increased tenfold in opposition-controlled territories in northern Syria. At least 30% are health workers. Coping is a challenge, especially because there was a health crisis before the coronavirus outbreak. Hundreds of medical workers were killed and facilities destroyed during the war in a deliberate campaign by Syrian government forces and their allies. Medical workers say they are on the brink of an emergency.
Before the pandemic, we used to work from 9 till 2. We are now working from 9 till 7 and sometimes even longer hours.
Despite that, testing remains limited. This medical laboratory serves up to 4 million people who live in Idlib and nearby areas.
Even when we have centers up and running, we don't have sufficient test kits. That is going to be a challenge coming down the line, to be able to test as many people as would be needed, and also people who are trained to analyze the tests. That also has been a challenge.
Efforts are being made to slow the spread by raising awareness and distributing hygiene kits. In this densely populated and impoverished region, where many live in camps, sanitation is a challenge. With the shortage of medical equipment and supplies, as well as a weakened health infrastructure due to 9 years of conflict and government neglect, communities are vulnerable. Zeina, Khodr, Al Jazeera, Beirut.